CIDRZ is just not about infectious diseases and honing on to HIV. It does much more than just HIV. For instance, if we talk about cervical cancer, which is one of the non-communicable diseases, and you may be aware that cervical cancer is the #1 cancer found in women in our country. We've done a lot of work around how to screen for cervical cancer in women, not just HIV-positive women, but women in general, and how to treat those early lesions. Because you want to be able to screen and catch the disease early on prior to it becoming florid or advancing, and then having these women travel hundreds of kilometers to Lusaka, to the Cancer Diseases Hospital. So we've done a lot of work with the ministry in terms of cervical cancer screening and treatment of early lesions. And then also around cervical cancer, we've done work on the vaccine that prevents the human papillomavirus, HPV vaccine. That virus is actually implicated in the genesis of cervical cancer. So the rollout or uptake of HPV vaccine amongst young girls. So working with communities, traditional leaders, to get them to understand what this vaccine is all about and why it's important to get their young girls vaccinated. And this is vaccination for girls between the ages of 9 and into the early teenage years. So it's not a group or a population that typically take in for vaccinations. So a lot of awareness and education had to be done to get communities sensitized and actually accept those vaccines.
CIDRZ has been really at the forefront of improving TB services, especially for people living with HIV. So one major project that we did with an implementation science approach was taking evidence that we knew from the region showed that starting people on antiretroviral therapy for the HIV early after a TB diagnosis can extend their lives. But the challenge was, how do we bring that into a health facility so it can happen in the real world? So we had worked with our partners from CDC to develop a one-stop shop for tuberculosis and HIV care in tuberculosis clinics. And we were able to show that by bringing those services for HIV, including treatment initiation and follow-up, into the TB clinic, that we could improve the uptake of antiretroviral therapy for people living with HIV who had TB, and also improve the proportion that sort of continued on treatment over the short term.
And since 2010, we have continued to work in prisons, and really the work is focused at strengthening the systems to ensure that there is ongoing TB screening, but combined with HIV screening among people who are incarcerated in these correctional facilities.
CIDRZ led a study between 2016 and 2019 in providing universal test and treat for HIV within correctional facilities in Zambia, in collaboration with partners in South Africa and South African prisons. And so what we were able to do is show that we could take an intervention from the community, like testing people at scale and starting them immediately or rapidly on treatment, and transfer that best practice that we know works from large clinical trials and bring it into a challenging setting like Chimbokaila, Lusaka Correctional Facility here in Zambia. And we were able to offer that intervention to incarcerated people and then follow them with time. And what we were able to see is that we could reach more than 90% of the incarcerated people that we enrolled with HIV testing, and that for those that remained incarcerated, we were able to retain them in care at above 90% and achieve viral suppression at above 90%, which really matched what community programs were doing. So in a way, we were able to show that what was possible in probably more feasible settings like a community clinic was also transferable and doable in a really difficult setting like a prison.
With the coming in of institutions like CIDRZ, I think we saw a formidable approach in the manner in which tuberculosis situations were handled. Screening was done at entry. There were follow-up screenings that were done. Those that were found to have the bacilli were commenced on treatment and they were isolated. And so there was that coordination towards the, responding to the increase in TB cases that were recorded.
Efyo ningatasha sana kuri ba CIDRZ bale naba bombenchi toyikulu sana mu community yesu. Abantu they are not defaulting. Abantu balekwanisha okwisa kuma clinics mkukonka ma next appointment eyo babapera balekwanisha okuyakonka. Then nama deaths na yachepa kwapa abantu tabalefwa kwatifirya balefwa akali awo. When I go in the community, I find someone who is TB patient. I help them. If the patient is a bedridden patient, I can get medicine from the health facility to their homes and help them how they can get their treatment, how can they drink their medicine.
CIDRZ chabe pane nabwera. Unabwera wankala muzambo konka mu community ma default. Kulivena ngwazayamba mankwala ankala ankalirira.
CIDRZ is a key partner for improving the health of Zambians, taking the issues that we find on the ground, finding solutions ideally, and then implementing those, and working with the partners and with the ministry to scale up those. And then not just scale them up and run away, but stay behind it and make sure the quality is maintained, that fidelity is maintained, that integrity is maintained. The general population who are HIV infected or living with HIV have access to treatment, have access to awesome treatment, really good high quality treatment, and mostly the Ministry of Health can manage to provide that, to manage them, to manage first, second and third line treatment. The systems are in place, but really now working with ministry to target those that are what we call resistant groups, so groups that are not coming forward, to try and help them. Because if we want to reach our 95 targets, we need to get everybody, and we need to get everybody who's HIV positive onto treatment, and once they're on treatment, get them suppressed. So that's the only way we're going to win.
The partnership with CIDRZ has improved the quality of healthcare in Zambia. The ultimate impact is the reduction in deaths and hospital admission because of the research that CIDRZ has done in the area of HIV. For example, the scaling up of differentiated service delivery models where the provision of HIV prevention and transmission and treatment services are moved from the health centers and hospitals to the community, and then people can access such services in their neighborhood. That has tremendously contributed to reducing the long queues that used to be the norm in some of our government health facilities in the past. This was done through CIDRZ's contribution to building the capacity of healthcare workers, community health workers, and other community-based volunteers through various training and mentorship programs.
The work of CIDRZ continues to be vitally important. We've had success in the rollout of ARVs, but that was many years ago. Now, it's a question of getting the treatments to as many people as possible and transitioning to prevention.
Currently, CIDRZ is involved in a number of implementation science research activities. One, for instance, is focusing on understanding why key populations living with HIV are dropping out of treatment. As you may be aware, we can only effectively address the HIV epidemic if those people living with HIV are retained in care. And one specific group that is of interest to CIDRZ is ensuring that key populations that are living with HIV are actually retained in care. So as part of implementation science, we've been looking at trying to understand the reasons why key populations living with HIV and initiated on treatment are actually dropping out of treatment. We've also been focusing on understanding why key populations who are not living with HIV but at higher risk and have been initiated on pre-exposure prophylaxis are not continuing with the treatment. And the reason is that we want to ensure that those key populations that are HIV negative remain negative. And those key populations that are living with HIV are retained in care and subsequently attain viral suppression, which is key towards controlling the HIV epidemic in the country.